Matter of fact, I just said to Alex that someone emailed me and I needed to respond to it. So I'm glad you made it.
Yes, so I'm pulling double duty all week. My husband's gone, so I work full time. So I just fed my son dinner, and so hopefully he's good for the next hour.
Okay, well, sounds like we can relate. I'm pulling double duty as well, but we're going to go ahead and get started since it's 5:30 and this is recorded. So if you happen to have to step away and come back, then you'll still have access to this. Okay. Okay. So welcome everyone to Occupational Therapy, 10 Simple Steps to Independent Contracting. My name is Tomeico and I'm going to be the facilitator of this webinar, facilitated discussion this evening. To start off, I just want to give you some background about myself. For 15.5 years, I've been working in independent contracting through my business Therapeutic Solutions in innovative settings such as eye centers, group homes, most recently at a farm that serves people with mental health diagnoses. I have a master's in occupational therapy from UNC Chapel Hill and a certificate in low vision rehab from UAB. In addition to running Therapeutic Solutions, I'm also a business consultant and a certified business coach and author. I have a strong passion to encourage and empower other occupational therapists to go into entrepreneurship. And I do this through Facing Consulting. So there's individual consulting and coaching as well as lectures and presentations regarding entrepreneurship. And then lastly, I am a curriculum writer and an educator in entrepreneurship in the OTD program at Rocky Mountain College. And I lecture once a year over 4 semesters, integrating entrepreneurship curricula throughout the program. So our objectives for this evening, in addition to sharing my history about independent contracting and innovative settings, I'm going to go over some steps to independent contracting, and then we'll have some time at the end to discuss and answer any questions that you all may have about independent contracting. I'm going to move to another slide here. So I said in the beginning that I've been doing independent contracting for over 15 years, going on 16 years. And I first began in independent contracting 2 years after graduating from UNC Chapel Hill. And my focus began on working with people with developmental disabilities, and this really stemmed from a project that I did my second year in graduate school, where we did a needs assessment and looked at the community and saw where OTs could fit in. And my project focused on serving older adults who were looking at transitioning from the vocational workshop potentially into retirement. And I really used that to help me create a business that focused on serving adults with developmental disabilities. And I started off with just 6 group homes where I was a consultant for, and then it eventually led to 24 group homes within a year that I consulted with. And later I added site facilities, state facilities. We started off with just 15 hours the first year, but by the 12th year we were at 80 hours a week. And the contracts just continued to grow. We added additional group home agencies. We added a contract for adults with developmental disabilities. We also began contracting with home health agencies and adding subcontractors because, of course, I was not able to provide the services to all those different agencies, but I was able to create a contract agreement with other therapists who wanted to be independent contractors, and they provide services. I've also did contracting with telehealth companies, 2 public school systems, recently with the federal government, also community-based agencies, and again, as I mentioned earlier, a community mental health agency at a farm that serves people with mental health diagnoses. So if you're interested in an independent contract, and these are some steps that I'm going to go through to talk about just what do you need to do in order to get there? So the very first step, step one, find out if this is something that you really want to do, if you really want to be an independent contractor. And to do this, you need to have a good understanding of what the difference is between an independent contractor versus an employee, and do some personal assessment as well as a needs assessment. So some of you may have heard of a 1099.
Will now be recorded.
If you all could please turn your volume off or mute your screen, please. So you may have heard people say 1099. Are you going to be a W-2 or a 1099? So a W-2 is an employee. It's the tax form that you get at the end of the year that tells you how much taxes were taken out of your income, versus a 1099, taxes are not taken out. You are a contractor. So a contractor is a person or a business who performs services for another person, and you just have an agreement, but it's very specific that the two of you are not in an employee-employer relationship. So as a general rule, the independent contractor is providing services, but the company that hires you is not in control of how you provide the service. Okay, so for example, when I contracted with the group homes, they told me what the outcomes were for the contract, what I needed to accomplish, but they didn't come in and say, well, Tomeico, you need to do this specific assessment whenever you come to the group home. They just said you need to assess X amount of people, X amount of frequency for X amount of time. And then I had to decide how I was going to do that. So they don't have control. They're not supervising you. And to further understand independent contractor, I always tell people to check with the IRS, because they're very specific in terms of what a person can do as an independent contractor versus an employee. So you can always go to their website, and they have lots of resources about the differences between the two. And I've included a few of those on this PowerPoint. So let's look at some of the differences. As an employee, the therapist is working for an agency or company. But as an independent contractor, you're self-employed and you're providing services for the company. As an employee, as I stated earlier, you get that W-2 at the end of the year. It tells you the taxes that were taken out from your earnings. But as an independent contractor, you're paying your taxes. You're going to get a straight amount of money that has been agreed upon, and you're responsible for making sure that your taxes are paid. As an employee, you have liability coverage. As an independent contractor, you're responsible for getting your own liability coverage. As an employee, workers' compensation is included, but as an independent contractor, you're again responsible for workers' compensation insurance if it is required. For the companies that I've contracted with in the past, only one has asked me to have workers' compensation insurance, and that was a home health company. As an employee, your salary is typically predetermined. I mean, there always is some room for negotiation, but there's usually set salaries. Versus with an independent contract, as an independent contractor, there's more room typically for negotiation for that rate. You have a job description as an employee versus as an independent contractor. You have a contract, and a contract will define what your duties are. Many of my contracts at the end, they have an addendum that outlines expectations. The job is typically indefinite as an employee, of course, considering certain limitations, but as an independent contractor, there's usually a term in the contract that says, at any time, for any reason, either party can terminate the contract as long as they give a 30-day notice. And then there's also something that says that they could also terminate it beforehand if there's like something unethical that has happened, or you violated the terms of the contract. As an employee, your pay typically is consistent. They may say you're going to get paid, every 2 weeks or once a month. But as an independent contractor, you are typically paid within a certain amount of time frame, and that may vary. So they may say no later than 30-day net. And I've talked to some people and they didn't really understand what that meant, but it basically means that once you submit your invoice, then you have 30 days from that date for them to pay you. So they could pay you in 10 days, or they could pay you in 25 days, or they could pay you, in 30 days. So I tell a lot of people that I work with not to get too used to a contract agency paying you beforehand because they don't have to. So I've had in the past where a contract agency paid me consistently every month on the 10th. And then all of a sudden the budget became tight and that check did not come on the 10th. It came on the 30th, the 30-day from the date of me submitting the invoice. Another thing to think about with that is that since it's 30 days from the time that you submit the invoice, and again, that's typical, it could be less or more, there's usually a lag for that first payment. So let's say you start working with an agency on May the 1st, and they tell you to turn in your invoice no later than June the 3rd. So you've worked all of May, and then you turn in your invoice June the 3rd. So your payment for your work in May is not typically due until July the 3rd, because that's that 30-day net from the date that you turn in your invoice. More differences. Employers typically provide benefits such as health insurance, paid time off, sick leave. As an independent contractor, you are responsible for all those benefits, such as your health insurance. You're not compensated if you get sick or if you go on vacation. As an employee, therapists typically work a set amount of hours per week. And independent contractor, your hours may vary. So your contract may say up to X amount of hours per week. And then I've even seen contracts that say up to X amount of hours per year, and you're responsible for keeping up with that and not going over those hours or the budget. The employer is typically responsible for ensuring that the therapist is paid according to the salary or budget. And then again, as an independent contractor, you may be the person that's responsible for ensuring that you're working within that budget. Another question that's often asked about independent contracting is, well, what's the difference between that and working PRN? Well, the main difference is that if you're working PRN, you are still an employee. So all the differences that I just talked about apply. PRN employees, they still may have fluctuating hours. They're working as needed. So they may have a lot of hours one week and less hours the following week. However, a PRN person is an employee and not a contractor. Because as a contractor, you have agreed to the terms of the contract and a set number of hours. So I ask you all to just think about your personality and yourself, because as an independent contractor, you are self-employed. So you want to think about your personality traits and if it's a good fit for you to become an independent contractor. And some people will partner with other people, if they really look at themselves and they see that they have certain challenges in terms of being able to be self-employed, and they may partner to create a contract agency, complement each other. These are some questions to consider. Ask yourself, are you a risk taker? Are you flexible? Are you willing to commute? Many times agencies are more likely to hire contractors if there's a high need. A lot of agencies prefer to have employees if they can. And if they cannot, which in many rural areas, there's higher need and they're willing to hire a contractor. So many of my first state contracts were in rural areas with over an hour commute. Are you willing to work in different practice settings? Are you willing to perhaps take 3 or 4 contracts to create your ideal schedule and amount of hours that you need? Does your financial situation allow you to have times in lack of employment or late payments? So can you handle, potentially getting paid late? So even if the contract says you're going to get paid in 30 days, but for some reason there's a budget issue and they break the contract terms and they let you know, oh, well, you're going to get your payment on the 40th day. Can you handle that? Or can you handle if they're cutting the budget and they terminate your contract within 30 days as it states in their contractual terms? Do you like to network? Are you a person who enjoys meeting new people? Because you're going to want to get your name out there as an independent contractor and let people know that you're available and agencies know that you're available. Are you organized? Can you make your own schedule and accomplish the required duties without direct supervision? Other questions, are you a good financial manager? Again, you're not paying your taxes, so you have to keep up with it. Can you stay within that budget? Can you keep good records? They may ask you for a log of the activities that you've provided or the task. Can you keep files of your incoming and outgoing expenses, or have someone to be able to do that for you? Can you work independently? Can you work without other therapists necessarily being around? How ambitious are you? How hardworking are you? How innovative are you? And are you good at what you do? What's your reputation like? These are all some things to just consider if you're interested in going into independent contracting. I have here also some links to other entrepreneurship assessments that you all could click on and just complete and assess yourself in terms of what your strengths and some of your challenges might be if you chose to go into independent contracting. And I ask here, how did it go in terms of the questions that I just asked, but I also mentioned that no one assessment can truly say whether or not you're cut out for independent contracting or entrepreneurship, but it does help raise your awareness of what your challenges are and where you may need to supplement more. So after you understand what independent contracting is as an entrepreneur, the next step that I recommend is looking at your passions and your needs. So really thinking about the population and the setting that you would like to work most in and what your ideal practice would look like. And so I ask here if you just come up with like 6 areas of practice that you're most passionate about, and think about how you're going to tailor your marketing to the agencies that you want to independently contract with. So I just had an example here. In the beginning, I was doing a lot of contracting with multiple different, multiple agencies, and one was a home health agency, and I later decided that that wasn't really a passion, and for now we don't contract with any home health companies. Think about your lifestyle. I put some pictures here of just different things that I like to do. We're all occupational beings. We like to be engaged in different occupations, and work is just one of those. There's folks who like to work more hours and people who like to work less hours. I personally like a lifestyle business, and independent contracting lends very well to having a lifestyle business. So think about how would independent contracting fit into the scheme of your life. And this is here where you would list your top 6 of preferable practice settings as an independent contractor. So I have here, is there a need within this exact same step? So even though you have a passion, you also want to make sure that there is a need for your service, because if there's not a need and you're just passionate about it, then who's going to actually hire you? And how do you assess that need? You do a needs assessment. And I have here a sample of some of the things that I did when I was assessing the need in the community. I checked the Occupational Outlook Handbook. I looked at the local newspaper every week. I looked at job openings in the Advance magazine. So there was an OT magazine that came out. And actually I landed a very large contract from watching that magazine. Every month there were certain positions that were advertised every single month over 3 and 4 months. And so I knew that there was a huge need, and they may be willing to hire an independent contractor if they could not fill that position with an employee. I also looked at the North Carolina, I'm in North Carolina, so I looked at the North Carolina OT Association's webpage and their job postings. I contacted local employers. I asked supervisors if they were willing to hire contractors. I mailed out brochures. At the time, when I first started with the group homes, I sent out brochures to every group home agency, I believe, in the state. And I looked that up under the North Carolina Division of Facility Services. So every state has a agency that governs facilities. And in North Carolina, it's called the North Carolina Division of Facility Services, and it's public knowledge. I also researched health trends, such as the aging population, community-based services. In North Carolina, we had mental health reform. And I spoke with other independent contractors in rehab fields, so people that I knew who were already successfully providing independent contracting services within the allied health professions, so OTs, other OTs, but also speech therapists and physical therapists. Then I checked out the competition, so who else was doing what I wanted to do. I researched that and looked for service gaps. Looked at healthcare trends, again, I mentioned that earlier. And then I also collaborated with the SBA, the Chamber of Commerce, SCORE, which is a group of retired entrepreneurs who volunteer their time to help aspiring and current entrepreneurs, as well as local community colleges. So once a person has a good understanding of what an independent contractor is, understands their personality, their priorities, and check the need, then I've asked them to decide if they want to be incorporated or not, because you can be an independent contractor just using your name as a solo practitioner without actually being incorporated. The reason I chose to be incorporated is because when you become incorporated, it separates you from you personally from your business. So it doesn't completely remove you from liability, but it's a form of protection. So if something were to happen and someone was to sue, then they would go after Therapeutic Solutions, which is a separate LLC with its own EIN number, and not after Tomeico Faison and my social security number. So an LLC is one option. There's PLLCs, S Corps, and C Corps. I'm not going to get into the differences between all these different types of ways to incorporate. I just want to emphasize that you have the option to incorporate as an independent contractor to separate your personal assets from your business assets. An attorney can help explain the differences in these three types of corporations, as well as some of the pros and the cons of each, as well as helping you to understand what is allowed as a licensed practitioner, because some states require you to be a PLLC, which is a professional limited liability company, versus a limited liability company. After you decide if you're going to become incorporated, then you want to start looking at your insurances, because these will be an expense. General liability may be required. The contractual terms will define what types of insurances you have to have and what those limits are. I just recently was required to get general liability, I guess about 5 years ago. But before that, when I did not have an office within the city limit, I just had professional liability insurance. And health insurance, again, you're not going to be covered through the contract agency. So you're paying for your own health, your own dental, potentially workers' comp, disability insurance, long-term care, vision. So any type of insurance that normally would be covered if you were an employee, you need to look into getting those types of insurance on your own. I also have I do have disability up here as well. Short-term and long-term disability are also options for independent contractors. And I have this as step 5, but some people may incorporate this into this step 3 when you're looking at whether or not you're going to be incorporated. So I have that there in parentheses. But an attorney and an accountant are your friend. So I think sometimes people make a mistake of trying to do all of the legal paperwork as well as the financial paperwork on their own. And in the very beginning, when income may be limited, I can understand it, but sometimes it can cause you to spend more money versus actually save money. So I would recommend, even if you don't work regularly with an attorney or an accountant, at least have a relationship with an attorney and accountant. And some of them will provide a free consultation. So that's what I did in the very beginning. I had a free consult with an attorney, consult with an accountant. I meet with an accountant twice a year, and I work regularly with a bookkeeper every month. And I put QuickBooks in parentheses as well, because that's another option to help you keep your financials in order. But I call this your A team, and I honestly feel like they're worth their weight in gold in terms of giving you legal advice and helping you ensure that your financials are in order. Okay, step 6, determine your rate and your plan. So this is a question I get a lot about. How do you know what you're going to get paid? How do you determine your rate? And it's different for different agencies. So you want to think about your time, how much time you're going to be spending clinically as an independent contractor, but what additionally may be required, such as some of the things I mentioned earlier, like the different types of insurance and the fact that you don't get benefits. And if you get sick, you're not going to get paid. You want to think about those things when you come up with your rate, and There are options for some agencies to do hourly or either do a flat rate. So for some companies that I work with, we do hourly. And then other companies that I work with, for example, some group homes that are in further geographical, like longer distance away from me, we have one flat rate. So if I go out and see a person, then we get one flat rate, and that includes the clinical work and documentation time and any communication with the staff and so forth. Okay, step 7, review or write your contracts. So typically, agencies that have contracted with people in the past will already have a contract in place, and that may be written in their favor. So again, having that relationship with the attorney to review that contract and give you some feedback regarding. And then some other times the contract agencies may say, well, you know what, we are open to having a contract. We have not had an OT in 7 months and we really need one, but we've never contracted before. Do you have a contract that you can share with us? And in that event, again, an attorney is very helpful to help you draft up that contract. In the contracts that I'm familiar with, there's typically some standard language in every contract. So there's an explanation of what you're going to provide, what are your services, how often you're going to provide those services, how many hours, the time frame of the contract. So typically a year is very common. So it'll say this contract begins on this date and ends on this date. Some contracts will say that it will automatically renew after 1 year unless otherwise specified. And others will say it will be terminated and reevaluated to determine if they're going to renew the contract or not. There's also typically within the contract very specific language that you are not an employee. There's no employee-employer relationship, and that you're a completely separate entity. There'll be lots of times information about keeping confidentiality and following the rules and regulations of the organization, as well as any governing bodies. And then many contracts may have non-competes in them. So you want to read that carefully and have a good understanding of that should you choose to contract with the agency. They may say that, you know, upon termination of the contract for a certain period of time, you might not be able to contract with a competitor within a certain geographical location. Well, how do you, let's see here. Excuse me. Okay, so step 8, your marketing. Looking at options to market. How do you go out and how do you let people know, who you are and what you're doing? Creating a website is an option. In 2019, there are lots of options to create websites, and many of these are free. I created my website for Therapeutic Solutions back in 2003. I still have the exact platform. I've made some changes, but I used Homestead. And I was able to just kind of drag and drop. So it was for a person who's not necessarily tech savvy. Since then, I've learned to use WordPress, which has some more sophisticated features, but creating a web presence, because many times once you put yourself out there, people will look you up and they'll want to see your website. Brochures that you can drop off. As again, I used snail mail, and I mailed lots of brochures to people, and I also mailed marketing letters. Business cards, of course, flyers, and again, it's 2019, so marketing using social media is very popular. Step 9, so let's say you start out as an independent contractor, you're doing really well, and there's a high demand. You found a niche area and you can't handle all of it. So when I started independent contracting, I did not desire to work full time. I specifically wanted to work a certain amount of hours. And so I decided to expand with subcontractors, and basically meaning that I have this contractual agreement with a contract agency. And then I also have a contract agreement with therapists who will abide by the contractual terms with the contract agency as well. And in order to do that, you have to find out if it is allowed. So some contracts will specifically say that you, the clinician, is supposed to provide the clinical services and you cannot subcontract. And then other contracts will say that you can have subcontractors as long as they abide by the contractual terms. And it's just some things to think about if you are providing the service and you decide you do want to hire subcontractors. You want to ensure that you have enough funds to do so, because again, as we talked about earlier with your payment, it may be a 30-day net, but at times, and I've experienced this, that at times agencies may break their contractual terms, and you want to be able to pay your contractors, even if you don't get paid, if that's how you've written your contract between you and the subcontractor. Some contract agencies will write in their terms that you get paid when they get paid from the agency. But others will say, once they turn in their invoice, then they're paid within a 30-day net, for example. But if the agency pays you in a 40-day net, then you don't want to have to go back to your therapist and say, it's going to be another 10 days for you to get paid. So last but not least, I have here, just go get some contracts. So there's lots of places that OTs can contract. There's the traditional settings like your schools, your hospitals, nursing homes, but there's also non-traditional settings. And I really encourage OTs to think outside of the box and where our skill sets can be utilized in non-traditional settings, such as adult daycares, homeless shelters. In fact, we have a meeting scheduled for next week with a transitional community where it's a temporary housing for people who have been homeless. And OT is a perfect fit because many of these people need assistance with developing life skills and independent living skills and home management. Vocational rehab, again, this is where I did the project in the second year in OT school. PACE programs, these are federal government programs. I'm not sure if you're all familiar, but they serve seniors. They're similar to adult daycares, however, they are all inclusive. So in addition to having recreational activities, the healthcare professionals are at the PACE programs. And that's, again, it's a federal program all over the nation where, seniors go every day and their nurses are there, the counselors are there, the OTs and so forth, and they do contract with some providers. In the past, I've contracted with an eye care center. OTs can work in low vision rehab. They can work with optometrists, ophthalmologists, retina specialists, outpatient clinics, home health agencies, vision rehab. I've recently seen more advertisements for OTs to work, not vision rehab, but vision therapy. Pediatric optometrists who are doing vision therapy. I've seen advertisements for occupational therapists. The VA or federal government, group homes, and again, telehealth. So these are just some examples of the many areas that occupational therapists can work in as independent contractors and explore entrepreneurship. Some OTs may just prefer to stay as independent contractors, and others may decide to expand into other areas of entrepreneurship. I think that independent contracting gives occupational therapists an opportunity to explore entrepreneurship without fully committing to running a full-fledged company. So giving you that flexibility, but still the umbrella of working with another agency. So now I want to open up the last 20 minutes or so for questions and discussions about what I went over and just the questions that you have about independent contracting. So, Aaron or Macy, do you have any questions about independent contracting and occupational therapy?
This is Sandy. I have a question. Do you use some of the AOTA materials and how do you use them in terms of, if you do use them, for promoting AOTA or occupational therapy in general?
Yes, that's a great question. Yes, I actually do. So in community mental health, that's an area where many people don't understand, at least in North Carolina, the behavioral healthcare system and the healthcare system are fairly segregated. And typically occupational therapists are not working in community mental health. And when we go in, they're saying, well, why would we hire an occupational therapist? What are you going to do? So we do have a handout that we've created, and we've used information and evidence from AOTA, their website, about what OTs can do in community mental health. What are some of those outcomes? We actually used it for our most recent contract, the one that's at the farm that serves people with mental health diagnoses. So we wrote the group description, we wrote what the outcomes that we wanted, and then we included that our services are evidence-based, and include some links to different articles that AOTA had posted about OTs working in community mental health. And I think in addition to persistent marketing, but also including that evidence, I think that's what helped us to be able to secure that contract, because people want to know, what are you going to do that's different from what everybody else is doing, and how, what outcomes are you going to be able to provide? And
I was just going to say thanks for answering that. I know that there's a whole section on the AOTA website about what is occupational therapy, and I didn't know if any of the materials there are helpful as well for just generically, just giving a definition for occupational therapy, or you've used anything there. So I was just curious. Thank you.
You're welcome. You're welcome. I've also used it at the eye center. So there is AOTA has tip sheets on living with low vision, and I use those often as well.
Hi, this is Erin. Can you hear me?
I can, Erin. How are you?
Oh, okay, good. So I actually used to, when I lived in North Carolina, I did some contract work in group homes, but I was a subcontractor. So now that I'm in Virginia, our local group homes, actually one of them is 2 doors down from where I live. I know that they could absolutely use OT services, but I'm having a challenging time kind of getting my foot in the door with the agency. So do you have any suggestions for that?
So one of the first things I would ask is do you know if the group home agency, if they're ICFs, which stands for Intermediate Care Facilities? Because if they are intermediate care facilities, then they are required to have occupational therapy for their residents should they need it. So in many group homes, they get a bed rate for persons that live there, and within that bed rate, that pot of money that they get for that person, they're supposed to provide services that are needed. So explaining to them that you can help them stay in compliance is one way to get your foot in the door if they are ICF facilities. So and it's very important for them to stay in compliance for multiple reasons. Of course, first priority is that the person can get what they need, but also there's financial ramifications for them not being in compliance. So depending upon the agency and their budget, they may be reluctant to add an additional payment for a service out of that flat bed rate, but having a good understanding of what is required and how it can financially hurt them if they're not in compliance. So for example, one agency that I used to contract with, they hired us, they had me come in as a contractor, but I would make certain recommendations, and there was some reluctancy to have me continue to follow up because of the budget. But at one point there was a tag, they call it a tag, where the facility, North Carolina Division of Facility Services, came in and said, this person should have this. And since they don't, we're fining you. And that amount of money was much more than if they would have just went ahead and continued to pay for the OT services. So finding out if it is an ICF, to see if it is required, but also thinking about what Sandra had just asked me a few minutes ago, using AOTA as your resource to help you articulate what OT is and create your marketing materials that includes evidence of how effective the services are and how it could potentially even, save them money, but also improve the quality of life of the people that reside at the home.
That is great information. Thank you. And I'll have to check on that. I know the group home is individually owned, but it is associated with our local ARC. And I treat children, so I have a pediatric practice, but I treat children who go to the ARC to their daycare program, but then they also have this adult program. So I obviously have to do a little bit more research to see more about that relationship and if they do need to follow the regulations for ICF and all of that. But that's great information. Thank you.
You're welcome. And do you contract with the ARC? Is there potential for you to go directly through the ARC? Because we've contracted with the ARC in the past and with agencies associated with the ARC.
That is also something I need to look into. I know I spoke with someone about 5 years ago about that. They were looking to hire their own employee for OT, and they, to my knowledge, still haven't found somebody. So that's definitely something that I can revisit.
Right, and if you know that they've been looking to hire for a certain period of time, as I mentioned before, agencies and organizations may not be initially receptive to hiring a contractor, but if they're unable to fill that position with an employee, then they may be more receptive. So if you say, hey, I noticed that you have had this position now open for 3 years, and find out what are their pain points. So what are people not getting because you have this need for an OT and you've not been able to fill it, and how can you help them to meet that need?
Yeah, that's definitely some good input. Thank you.
You're very welcome. Any other questions?
I do have this is Erin again. I do have, if no one else is going to ask. I'm interested to hear about any experiences you've heard of with OTs contracting with developmental optometrists. So we work very closely with our local developmental optometrists, and that we collaborate very frequently and call one another regarding mutual kids that we see. But I'm interested to hear what you may have heard about OTs actually doing some contracting work with developmental optometrists.
So I actually don't know any OTs that are contracting with developmental optometrists, but where I have vision therapy on this last slide, that's what I was referring to. So developmental optometrists, I've seen advertising now for OTs. So what I do know is that vision therapy, as far as I know, either is not necessarily a reimbursed CPT code, or either is reimbursed at a significantly lower rate than occupational therapy. And I've had conversations with developmental optometrists about use of the OT codes, because one actually approached me and said, well, we saw the OT CPT codes and we really saw the difference in that rate versus the codes that they were using, the rates that were associated with the codes they were using. And they tried to bill, this person told me they tried to bill the OT codes, but it was denied, of course, because they're not OTs. So OTs can contract with developmental optometrists and providing pediatric services and working with children who have visual deficits. And an advantage is that they can then bill for OT and use those OT CPT codes. Of course, your NPI number would be required, and you would need to be in network with the different insurances, but you're not necessarily billing the insurance because you're an independent contractor. So again, the agency is taking care of all of that, and then you're negotiating a rate, which could be a flat rate, could be an hourly rate, could be a percentage of the billable rate that they're billing, because they're bringing in, they have the kids and they have the established organization, and you're coming in and provide the clinical work. You can work out an agreement in terms of the percentage. There may be some education that is required in that arena about the reimbursement as an OT and how they get credentialed. And that is one of the things that I've also had to do in community mental health. Right now, we're just getting paid a flat rate for our services, but as we're doing that and they're pulling it out of their budget, we've had discussions about the fact that OTs can bill for mental health services in the community. We typically do not, but we can. And that's something that we're looking at in the future for this particular agency. Our agency has been able to bill for working in the community with people with mental health diagnoses, and we've been reimbursed for it. And so that's one of the things that I said to the agency, in the future, we could look at your agency billing, so it's not coming out of your budget for these services. But they don't know anything about OT CPT codes or how they would get credentialed with insurance. So there's a lot of education that takes place in order for them to have a better understanding. But it does make agencies who are budget conscious more receptive.
Yeah, thanks. I know in my area, the developmental optometrists, they don't bill insurance, but they encourage families to submit reimbursements by using the therapeutic activities code. And so when our kids are coming to my clinic and we're billing the same code, and then the family's trying to get reimbursement for the same code, we run into some issues, as you can. And we don't do vision therapy per se as OTs, but we're very knowledgeable in the vision related activities. Right. So it would be nice to create better partnerships with our local developmental optometrists so that families can get services covered, but yet we can go to the doctors on a more regular basis. But then again, for our developmental optometrists, then we're taking away from what their vision therapists are doing. So we've kind of been at this back and forth for quite a number of years, and I was just curious if you had heard anywhere along the road of any OT being successful in their pursuits of collaboration with developmental optometry and vision therapists.
No, but I know that developmental optometrist that I talked about earlier, she's very receptive to have an OT, and if you're interested in getting in contact and asking some questions, I wouldn't mind sharing that information with you after this facilitated discussion. I'm curious to know though, are they able to build that CPT code because in North Carolina, I know the person that I just mentioned said she was not able to bill for that code. So when these families take, I guess the super bill, they take that claim, are they getting reimbursed for that CPT code even though an OT is not providing the service?
So some of them are and some of them are not. It depends on their insurance, and it also, I think, depends on which diagnosis code that they're using. But yeah, basically they're taking that super bill and just filling out the paperwork themselves, and they kind of know up front it's going to be all out of pocket. So if they get something reimbursed, it's like, oh wow, I get this check in the mail.
Right. So it's like hit or miss, versus with OT, it's pretty consistent for certain established CPT codes for occupational therapy.
Can I add something? This is Alex.
Hi, Alex.
Hey there. I had some good success with doing screenings for handwriting problems. So you can go into even kindergartens or elementary schools and so forth. And oftentimes handwriting will be a predictor of other issues that are going on, be it vision and so forth. So a quick free screen, even to, let's say, kindergarten place might actually yield some potential clients for you if you're looking for the little ones.
It's a good idea, Alex.
By the same token, now that I live here in Florida, I actually was introduced to individuals who work with people who are senior or who are losing vision. And so obviously that might be a great avenue also to do home modifications and safety and so forth, and helping people as they're transitioning into, I suppose, losing their sight or having decreased sight. So that's another avenue.
Yeah, I'm glad you said that, Alex, because vision therapists or the developmental optometrists, they don't go into the home, and typically, and for you to be able to come in and say, we can work together, so you see them in the clinic, but you don't see how that transpires to their daily routine, their habits, how they're functioning in their natural environment. If you're able to provide that service, that's also another way to form that partnership and that contractual relationship.
And then one last point, a couple of years back, quite a number of years back, I took a course on low vision, got a certification and so forth. So if any of you are interested, I'll send out my email. So if you look under the text of, I don't know where that appears on your window, but I'll gladly give you some of the links and suggestions. And she had an entire marketing strategy for what she does at the back. I just never utilized it, but I'd be more than happy to take pictures and email it to you.
That would be great, Alex. Was that through Mary Warren by chance?
Oh my gosh, I'll have to go take a look. But it is a several thick binders worth of stuff. And there was a huge section on, she did press releases and notes and suggestions and groups and so forth. Some of them may be outdated because it's been a number of years, but I'm assuming the overall plan for marketing that as OT services is still good. So yeah, my email is alextheot@gmail.com. So,
Yes, I'm wondering. Go ahead.
Sorry, no, I'm done. I'm gonna mute.
Okay. I'm wondering if it was Mary Warren, because I used her resources as well, and it sounds very similar, where she had marketing letters. I believe the resource was called How to Start a Low Vision Private Practice. It also included the CPT codes, and Mary Warren was very instrumental in allowing optometrists to refer to OTs and sign off on plan of care for Medicare. And she was actually recognized at the AOTA conference. She's just done a phenomenal job in low vision rehab and still has lots of resources out about how to start and grow a low vision rehab practice. And I attribute a lot of my success in that area to her resources. So we have about 5 minutes left. Any other burning questions or thoughts?
I have a quick question. Can you hear me? This is Macy.
Hey, Macy. Yes, I can hear you.
Do you have any advice or suggestions regarding doing independent contracting with nonprofit organizations that don't provide treatment but are more in the advocacy realm?
So the same marketing strategies, I think, that I mentioned earlier, the brochures, the presentation, so forth, and defining what your outcomes would be. If you could say more specifically, what exactly would you be doing with the nonprofit agency?
So I recently finished the USC lifestyle redesign series of courses, and I would like to go to various like mental health or wellness nonprofits, and I live in the DC area, so it's filled with those kind of groups, and present to them about like the general concepts of lifestyle redesign and how they could incorporate that into their literature or their education to the people they reach out to. Okay,
so it sounds like you sort of answered your question. Doing a presentation, that's been very effective for me as well in terms of marketing. Is just going to an organization and asking if you could do a presentation, and including again the resources from AOTA with evidence in terms of what outcomes can be provided if you implemented a lifestyle redesign program with their nonprofit. Have you tried doing a presentation?
I haven't. I'm actually in the process of building a presentation, but
Okay.
have not yet
Okay.
completed it or tried it out.
Yeah, so a presentation, I do lunch and learns quite often, just providing information. And again, I'm going to keep emphasizing using your AOTA resources to show that our services are evidence-based and have a history of proven outcomes.
Thank you.
You're welcome.
This is Sandy. I just put something in the chat room that AOTA does have a low vision certification program. So you can become certified in low vision. And I am not sure if Mary Warren is the person who led that program, but it may very well be. So I put the link in the chat room for you.
Okay, thank you very much, Sandy. We have, so I have several contractors with therapeutic solutions, and some of them have done the low vision rehab certificate from UAB that I mentioned earlier that I also did, and then others are going the route through the 3 courses that I believe are in the link that you sent, Sandy. I think there's 3 badges that you can get in low vision rehab now through AOTA, which is very nice, and you also can become board certified. I believe at the AOTA conference, they mentioned that there's a change from completing the paperwork and creating your profile to become board certified to an exam. It's going to become exam based. I don't know if Alex or Sandy, you know when that change is supposed to take place, but I know there's going to be a transition to exam based board certification through AOTA, and low vision rehab is one of those. Are any of y'all familiar with that new change?
I just read that it is supposed to be happening. The first few certifications are supposed to be switching over in the fall of 2020.
Okay. Okay.
I'm sorry, this is Sandy. I was on mute and I didn't realize it, so I was talking. That is absolutely correct. It is turning into exam-based. I wasn't even clear exactly what the targeted date is, but I did look at the link that I just sent you. It does mention that University of Alabama program, so I think we're talking about the same thing. So yes, there's badging, which is through our continuing education, and then there's these certification programs. So we have many different methods for increasing, one's learning and working on one's own leadership path.
Yes, and it's the therapists that I know that have completed the modules for the badges have given me really good feedback about the content and flexibility, as well as support they've received as they went through those modules. And I did before it was badges, there was a self-paced course. I'm not sure if that's still available or not, but I did that through AOTA as well, and had a very good experience. Yes, I agree, Sandy. It's very popular. It's a good way to get specialized knowledge within that emerging. I think it's still a very emerging practice area within OT. Welcome. Okay, thank you all for joining us. My contact information is, I believe it's on the first slide. It's my first name. Well, no, it's not, so I'll put it here. Let's see if I can figure this out. It's my first name, Tomeico, at tsofnc.com. If you have any other questions about independent contracting, I also have a lot of affordable and free resources that I can direct you to regarding independent contracting if there's other interest, and encourage you to use AOTA as your resource and continue to participate in these facilitated discussions. We have a great lineup. I think Alex has done a really good job of creating a lineup of professionals from within the occupational therapy profession, but also outside, who can help you grow as an entrepreneur in the field of occupational therapy. Thank you.